The SOAR Act, as you guys might be familiar with, is super important. As you can imagine, patients that might be from rural areas have to travel long distances in order to get care. What that means is if they don't have access to the liquid oxygen, that means that they're carrying these large compressed cylinders, sometimes an entire vehicle full, just to make that long distance trip to go get the care that they need. So you can imagine how much of a barrier that is for patients that have to travel to access care. So we're advocating for the SOAR Act to make sure the patients get access to the medicine they need, which also includes oxygen. Imagine not being able to breathe and how that can limit you from not being able to go about your day and live your life, especially for patients in rural communities.
The lungs' primary problem is to supply oxygen, but in those patients who have a disease where that's not working properly, we need to support them with the ability to have oxygen so that they can continue to have some quality of life.
Hi, I'm Melissa Magnus. I'm a pediatric nurse practitioner who takes care of lots of little kids with pulmonary hypertension. And this disease process really affects their lungs. They can have their oxygen levels be a little bit lower. So having good access to oxygen helps them do what they need to do on an everyday level, which might be, running around with their parents chasing them, or that means like going to school. And so having access to oxygen that actually is portable and it's something that they can carry with them, and that is liquid oxygen is a really helpful avenue for that, is a really important thing. And right now there is no access to that.
Hi, my name is Amy Keefe. I'm a pulmonary hypertension coordinator. Many of my patients need supplemental oxygen, and sometimes it's difficult for them to get that oxygen due to insurance costs, or they have to pay out of pocket. And having oxygen is essential for them to breathe, to leave their home, to do many daily activities, improve their quality of life. And if they don't have access to that, they don't get any of that. And we need your help to support the SOAR Act.
We urge all of our legislators to sign on and to pass this act. It's going to reform oxygen delivery, and it's going to make it so that our patients can get access to liquid oxygen, which is exactly what it sounds like. It's just compressed gas into a liquid form, so patients can have a much longer reservoir and a much higher flow rate, and they can actually live their lives outside their house and enjoy being alive, being out there. And so without that, we're stuck at home, but pass the SOAR Act and you can give our patients freedom.